This is Michael Smith of MedPage Today. I'm in Philadelphia at the annual meeting of the Infectious Diseases Society of America. I'm speaking with Dr. Nancy Crum-Chen-Flone, who is a researcher at the Uniformed Services University of the Health Sciences. She's stationed in San Diego. Dr. Chen-Flone is reporting new data on the interface between obesity and HIV. Doctor, in the early days of HIV, the issue was wasting. You people recently, a couple of years ago, showed that in fact obesity is becoming an issue among people with HIV infection. But you're reporting here that the obesity actually has an effect on their immune system. Can you describe what you did, first of all, and then we'll talk about what you found?
Sure. What we've been noticing is our HIV patients are becoming more overweight and obese, and we know that being overweight or obese in the general population has negative health consequences, heart disease, diabetes, and so forth. And so we wondered if there was an additional adverse consequence to obesity that might affect HIV patients. We adjusted for their age, we adjusted for whether they took antiretroviral drugs and so forth. And we still found this relationship that people who had excessive weights had lower CD4 counts than someone who had an appropriate weight.
Now this was lower CD4 counts over time. In other words, they didn't respond as well to therapy.
We think that there may be a couple mechanisms to this. One, they're not maybe responding as well to the heart therapy that's now available. Perhaps that's due to subtherapeutic drug levels. Maybe we're not dosing obese patients as well as we should. Also, it may be that obese patients have higher inflammatory markers. We know that that's true in the general population, and maybe obese HIV patients also might have higher inflammatory markers, and there's been recent associations between higher inflammatory markers, lower CD4 counts, and faster progression. Now, we didn't look at these as part of our study. These are just hypotheses, but what our study did show is that obesity equals what we saw as lower CD4 counts in our study.
Is the difference sufficient to have a clinical impact, do you think?
That's a really great question. We saw about a 40 to 50 cell difference between obese and normal weight persons. So I guess if clinicians think, having 40 or 50 cells makes a difference, then yes. We have not yet looked at clinical events. So were there more clinical events in obese versus normal patients, which would really answer that question the best.
Thank you very much, Dr. Chen-Flone. In Philadelphia, I'm Michael Smith, MedPage Today.